Hi, my name is Rocky. I'm a student nurse practitioner. I'll be doing your assessment today. This video is going to be uploaded on YouTube for the course. Is that okay?
Yes.
Okay. So I'm going to be assessing your head first. So I'm assessing her face, her skull, and her hair. Assessing the hair for distribution and texture, the face for symmetry, any involuntary movements, and the skull for any scarring, the shape of the skull, any trauma, and any lesions as well. So I'm going to go ahead and palpate your head. So I'm going to touch your head. Is that okay? So checking the hair is evenly distributed with normal texture. Checking for any depressions or hematomas, lesions, or cysts. I'm going to palpate on your temporal arteries as well, down to the temporal mandibular joint. And open and close your mouth. Good. Okay. So after assessing the head, I'm going to be assessing her eyes. I'm going to assess her visual acuity. So go ahead and cover your left eye for me. 6 feet away is the handheld chart. Okay. Read the lowest line that you can.
LTFPH.
Good. And then cover your right eye. Read the lowest line that you can.
LTFPH.
And good. Both eyes open. Read the lowest line that you can.
LTFPH.
Good. Okay, so after checking for visual acuity, I'm going to be assessing her eyes for any abnormalities, the exothalamus, ptosis, mydriasis. I'm going to be assessing her eyelids as well, checking the conjunctiva, lacrimal system, the sclera, iris, and cornea. So I'm going to go ahead and lift up on your eyelids. Good, and then down. Good. Noting that the conjunctiva is moist and pink, no discharges noted. I'm also noting that the sclera is white, no redness or jaundice. So after checking for this, her sclera, I'm going to be checking her pupillary reaction to light, both directly and consensually. So I'm going to go ahead and shine a light to your eyes. Go look straight ahead at me. And I'm going to be checking that the pupils constrict. So shining a light to your left eye. Good, and the right eye. Good. So pupils both reactive and equal to light by 2 milliliter bilaterally. And then I'm also going to be checking for pupillary reaction consensually. So I'm going to be shining a light to your left eye, and I'm going to check if there's any constriction to the right pupil. Okay. Good. And then other side. Good. And those are normal, no abnormalities noted. After pupillary reaction, I'm going to be checking for extraocular movements, which is your cranial nerves 3, 4, and 6. This is your oculomotor, trochlear, and abducens. So you're going to look straight ahead at me, and you are going to follow my finger. Good. And checking for any nystagmus, any involuntary movements, checking for convergence, which is normal, and I'm also checking for accommodation, which is the patient's or a person's ability to adjust or accommodate its vision from nearby and far objects. After this, I'm going to be doing an I'm going to be checking your visual fields by confrontation, so go ahead and stand up. Okay, so you're going to go ahead and cover your left eye, and you're going to tell me a number that you see to the side while looking straight at me. 1, 2, 3, 4. Good. And cover your right eye. Good. 2, 3, 4, 1. Okay, good. So you can go ahead and take a seat. Oh, and sorry about that. Can you take a stand? We'll do that, the same thing. Look straight ahead at me with both eyes open. 1, 5, 2, 3. Good. Okay, you can go ahead and take a seat. After that, I'm going to be doing an ophthalmoscope exam. I'm making sure that I use the equipment safely, making sure that I use my right eye for her right eye. That way our faces don't clash together. I'm also checking for cornea and lens, her optic disc, and the vessels around it, as well as the red reflex. So I'm going to go ahead and turn on the light. Okay, so you're going to look straight ahead. So standing away. You're looking for the red reflex. Look closer. Okay, and checking the other eye. Okay, so right eye to red reflex and coming in. Seeing the sharp. Okay, kind of keep your eyelids open. Okay, good. Okay, so no abnormalities noted. The optic disc is sharp. No hemorrhage noted as well. So now we're gonna be assessing your nose. I'm gonna inspect the nose. I'm gonna be palpating her frontal and maxillary sinuses. Any pain there? Any tenderness?
No.
Good. Okay. Okay, no tenderness noted or reported. I'm also gonna be inspecting her inside of her nose with the light, the mucosa and the turbinates. I'm gonna go ahead and grab my equipment, making sure I observe safety with it. So I'm going to shine a light, checking for any polyps as well. So I'm going to go ahead and inspect the nose. Hold on a sec. Okay, I'm going to go inside a little bit. Okay, and then the other side again, inside a little bit. Good. So after inspecting with the light, so turbinate patency, do you have any problems with breathing?
No.
Okay. And so go ahead and cover your one nostril. Good. And then breathe in and out for me. Testing for airflow, and then cover the other side. Good. Good. So after that, I'm going to be also checking her cranial nerve number 1, which is olfactory. I'm going to have you close your eyes. I'm going to close one nostril, and then I'm going to have you smell something, and you guess what it is, okay? Okay, so I'm going to cover her right nostril, checking for the left. Okay, and guess what it is? Orange. Good. Now I'm going to be checking her right nostril, so I'm going to be covering, occluding the left nostril. Okay, what is that?
Coffee.
Good. Okay, so after checking the nose, making sure there's no polyps or any discharge as well, no lesions, airflow is good, no difficulty breathing through the nose. I'm also going to be checking now her ears. I'm going to be checking your hearing acuity first. So we're going to cover can you cover your right ear for me? I'm going to whisper a word to you and you're going to repeat it, okay?
Apple.
Good. And cover your right, the other ear, good.
Baseball.
Good. Okay, so now we're going to go ahead and do a Weber's test, which is checking for hearing as well. Okay, so you're going to tell me if you hear the ringing on both ears or one ear. Placing it on your forehead.
Both ears.
Good, which is a normal finding. I'm also going to be doing a ring test. I'm going to place the tuning fork right behind your ear. Once you hear the ringing stops, I'm going to place it right by your ear, and you tell me when it stops on both times, okay? Stay right behind your ear. Stop. Good. making sure that the air conduction is greater or longer than the bone conduction, which is a normal finding. Okay, one more time. Stop. Okay. Good. After checking for hearing acuity, I'm going to be checking for inspecting her external ear, inspecting for any discharge or drainage, the color as well, and the shape or symmetry of her ears. And then I'm also going to be palpating the external ear and your tragus right outside the ear. So I'm going to go ahead and touch your ears, making sure there's no nodules or lesions or any abnormalities. Comparing both ears, none noted. Any pain, any tenderness or discomfort? Good. So after inspecting the ears and palpating the ears, obviously her hearing acuity is good as well. So now I'm gonna be testing for her for doing an otoscopic exam. So I'm gonna go ahead and shine a light in her ear. I'm making sure that I use this safely, pulling the pinna back and up for her because she's an adult. Shining the light right inside the ear, checking the ear canal, the tympanic membrane, cone of light as well. So I'm gonna be starting off with your left ear. Okay. Now pull back. I'm gonna brace the otoscope right on my hand. I'm gonna be checking your ear. Any pain? No. Good. And checking for her ear canal and tympanic membrane. No redness noted, no lesions. Tympanic membrane. Let's see. Okay. Noted some scant amount of cerumen. I'm just gonna, and then noted that the tympanic membrane is pearly gray white in color, which is normal. So now I'm gonna be assessing your her mouth. I'm assessing for her lips, her buccosal mucosa, the salivary duct openings. I'm assessing her gingiva for any infection, for hypertrophy, or as well as its pigmentation. I'm also going to be assessing her teeth, its dentures, any caries, any deformities or infection, and her tongue, papilla, and size. So okay, go ahead and open your mouth for me. Okay, I'm just gonna shine a light. Okay, and stick your tongue out. Good, and stick your tongue up. Let me see in the bottom of your tongue. Good. Okay. And then after that, I'm also gonna be checking her cranial nerve number 12, which is the hypoglossal, checking the strength as well. So go ahead and stick out your tongue. So noting that the tongue is midline, and can you put your tongue on the push against your cheek on the inside, checking for strength, and then on the other side. Good. And then now okay, that's good. And now I'm going to be checking for cranial nerves 9 and 10, which is glossopharyngeal and vagus. So go ahead. So I'm going to be checking the soft palate, uvular rise, as well as her swallowing and gag reflex. So go ahead and swallow for me. Good. Any pain?
No.
Okay. Any difficulties?
No.
Okay. Go ahead and say ah. Stick your tongue out. Good. Okay. So after so both cranial nerves 9 and 10 is intact. After the checking for the cranial nerves, while I was assessing her mouth, I also checked her posterior pharynx as well as the tonsils. And then grab it. Can you stick out your tongue a little bit more? And good. Checking for the tonsil and the uvula. With no abnormalities noted. After the mouth, I'm gonna be assessing her neck. First, we're gonna go ahead and assess range of motion. So you're gonna go ahead and do flexion, extension, and hyperextension. So go ahead and bend your neck for me, good, and look straight ahead and look up. Any pain or difficulties? No. Now we're gonna go ahead and do lateral movements and rotation. So you're gonna go ahead and look side to side. Slowly, good. Any problems?
No.
Okay, and then your head side to side. No, and then do a full rotation backwards. Okay, and then forward rotation. Good, and then the other way around. Good. Okay, no full range of motion, no limitation or difficulties. After the range of motion, I'm gonna be inspecting her spinal accessory, which is cranial nerve number 11. I'm gonna push back your hair. I'm gonna place my hands against your shoulders, and I'm gonna push down, and you're gonna go against resistance or pull up. Okay, ready? Go. Good. And then I'm also gonna be checking head turning against resistance. So I'm gonna place my hand against your cheek, and you're gonna go against resistance. Good. And then on the other side. Good. Okay. So after testing for cranial nerve 11, I'm gonna be palpating for her lymph nodes. There's a few sites, so I'm gonna be touching right along your ear to the back of your head, as well as your neck area, okay? So I'm gonna check pre-auricular, post-auricular. Any pain? Let me know if you feel any pain or tenderness. I'm also checking for occipital, which is right behind her head, and posterior cervical. Any pain? No. Good. I'm also checking for submandibular and submental, which is right by the chin. Going down to the neck towards anterior cervical. Any pain? No. Okay, and the supraclavicular and infraclavicular, which is supra, which is above the clavicles, and infra, which is below the clavicles. I'm also going to be testing for thyroid placement, which is or trachea placement, making sure that the trachea is midline. Before I palpate for the thyroids, I'm also going to be inspecting her swallowing. Can you go ahead and swallow for me? Okay, good. So I'm going to be checking her thyroid gland, making sure I inspect tangential view, making sure that I inspect her swallow before I palpate. I'm going to be palpating from behind you. So I'm going to go ahead and apply my hands to the isthmus of the thyroid, which is right by the cricoid cartilage. Okay, and then as she swallows, I should be able to feel my hands slide through it. Okay, let's go ahead and swallow. Good. Okay. Good. Any pain? No. No. Okay. So that concludes our head, ears, eyes, nose, and throat assessment. Do you have any questions for me? No. Okay. Thank you.